of this lecture is Endodontic Material Science. This lecture is for the foreign student of the third year, the module Endodontics. This topic is very important for the whole course and exactly for these classes. Right choice of various endodontic techniques depending on clinical situation is necessary for quality treatment of pulpitis and periodontitis. And actually the purpose of the lesson, know the classification and purpose of endodontic instruments, drugs and root canal, filling materials, and also have an idea of mechanism action of antiseptics and lubricants. As for endodontics, is the dental specialty concerned with the study and treatment of the dental pulp. There is the structure and function of endodont, and also the methods and techniques of manipulation in the tooth cavity. So endodontics is divided in two parts. It studies the structure and function of endodont, and as soon as methods and techniques of treatment. What is tooth pulp? Tooth pulp is loose connective tissue which fills the pulp chamber and root canal. The dental pulp is a part of the dentin pulp complex or endodontium. There is the pulp chamber and the root canal. The pulp consists of several parts. First of all is cells. Also it is intercellular substance. And the third part is fibers. Pulp contains also vessels and nerves in a significant number. Usually we divide root canal in several parts. First part, coronal part, is close to the coronal part of tooth. Second part is middle part between coronal and apical part, and the third part is apical, is in apex of the root of the tooth. As for the anatomy of pulp camera, is also very important. There is several parts of the pulp camera. First is pulp chamber, is inside of the crown of the tooth. In the pulp chamber there is roof and also the pulp horn. The number and the structure of the pulp horn depends on the anatomy of the tooth. And also in the pulp chamber there is floor of the pulp chamber and also anatomy of the root canal. Sometimes in the root canal there may be furcation canal apart from the central canal, and also lateral canal, and the part of canal which is in the root apex is called apical foramen. The structure of apex, the anatomy of apex also is very important. Anatomic apex is the tip of the root determined morphologically. There is anatomic apex. And also sometimes on the X-ray picture we can see radiographic apex. There is the tip of root determined radiographically on the X-ray picture. Apical foramen is the region where the canal leaves the root surface next to the periodontal ligament. There is apical foramen. And very important part of the apex is called apical constriction. Has minor diameter. Apical constriction is the apical portion of the root canal having the narrowest diameter. There is apical constriction. Apical, which is determined anatomically, is called anatomical apex. Is the red line. Red line match apex. Apical constriction match green zone. The narrowest part of apex match apical constriction, and also it is the part where green zone starts when we try to determine the root canal length using apex locator, electrometric method of diagnostic. It's very important to zone. Green zone when shows apical constriction, green zone should be not the point, just space, and also red line where anatomical apex ends. Classification of endodontic instrument. There are several groups of endodontic instruments. First is the tools for expanding of the mouth of the root canal. Is Gates Glidden, orifice opener, and also Lergo or piezo reamer. Gates Glidden and piezo reamer are similar, but piezo reamer has more longer working part. Next group is diagnostic tools. There are depth sounder to detect the length of root canal. Also for diagnostic of the root canal we use root needle. There are several needles, root needles, and also pathfinder is instrument for determining of the root canal and for the diagnostic of the length of root canals. Next group is for removing of soft tissue, exactly for removing of the pulp. It is called barred brooches. Is special instrument exactly for removing of the pulp of the soft tissue out of root canal, out of the pulp chamber. The removing of the root pulp is called extirpation. And very special instrument for the extirpation is called barb broach. Is an instrument used to remove pulp tissue, and it is manufactured from round wires, and the smooth surface is cut to form special barbs. Next group of endodontic instrument is for passing and extension of root canal. There are a lot of instruments, and the group are called K-reamers from the name care, K-files also from the name K, and H-files from the author Headstrong. K-reamers, K-file and H-file. As for the instrument, there are also several groups depending on their structure and also of their manufacturing. First group is stainless steel file. They have taper, special taper 0.02. There are K file from the name Care and H files from the name Headstrong. They have different structure of the working part of instrument. There is the working part of K file and different structure of working part of H files. And also another group of instrument depending on their manufacturing is Ni-T rotary instrument, nickeled titanium rotary instrument. They have another taper, different taper, depending on their size. It may be 0.4 or 0.6 taper. What is taper? Sometimes we have increase in diameter per unit length, and increase in diameter is called taper. We have the first diameter in the tip of the working part and in the end of the working part, and increase in diameter is called taper. It may be 0.2 taper and so 0.4, 0.6 till 0.96 millimeter diameter increase. Next group in classification of endodontic instrument is for filling root canals. Among them, the lentulo for the filling of root canal, spreaders for the filling using lateral condensation of gutta percha, and also such other instruments like condensers and pluggers when we use hot gutta percha for filling materials. As for standardization of the endodontic instrument is the color coding when special size match exactly special color. There is several standard color of instrument which is start from the color white. White color matches the number of instrument 15. Next color, yellow, match number 20. Next, red 25, blue 30, green 35, black 40, and so on. And also not standard color which match 3 minimum sizes of instrument. Pink is number 6, gray is number 8, and purple is number 10. Is minimum instrument for endodontical treatment, for the root canal treatment. As for geometric symbol of endodontic instrument, is also exist and special shape of instrument match for the special type of instrument. For the K-rimers is triangle, and further each instrument match special shape. The main purpose of endodontics is the root canal treatment, and synonym for them is endodontic therapy, endodontic treatment, root canal therapy. What is root canal treatment? It is the treatment sequence for the infected pulp which results in the elimination of infection and the protection of the tissue surrounding tooth from future microbial invasion. Root canal treatment involves the removal of the pulp, the shaping, the cleaning and decontamination using endodontic instrument and irrigating solution. And the obturation itself also is part of root canal treatment. And what obturation is? There is filling of the cleaned and decontaminated canals is done with an inert filling such as gutta percha, for example. Exposed resin is employed to clean gutta percha in some root canal procedures. Providing root canal treatment, we must follow special rules of work in the root canal. First of all, it is work in the wet canal. Next, at the level, we have to work at the level of working length. Next, we have to preserve of anatomical form of root canal during its preparation. Next point is consistent use of tools according to their function and size. The extension of the apical part of the root canal at least 2 sizes larger than the initial apical instrument. Next point, recapitulation of dentin fillings using smaller instrument. Wasteful use of endodontic instrument to prevent its breakage. And at last, preliminary beginning of tools when processing curved root canal. And very important to follow the sequence of endodontic treatment. There are some difference between sequence in the treatment of pulpitis and the treatment of periodontitis. The sequence of endodontic treatment of pulpitis includes carious cavity preparation or sometimes trepanation. Next, opening of the tooth cavity. Further, disclosure of the root canal cavity. Next, removing of coronal pulp or amputation. Next, expansion of the mouth root canals. Further, we have to research and measure of root canal length using different techniques and methods. And next, extirpation of the root pulp or removal of the root pulp. Next, we provide mechanical treatment and irrigation of root canal. Further, root canal obturation with rentgenological control, X-ray picture using X-ray. And at last, restoration of the crown of the tooth, the last stage. And the sequence of endodontic treatment of root canal during periodontitis includes next stages. First stages are the same that is in pulpitis. First, we have to preparate carious cavity or do trepanation of the cavity. Next, opening of the tooth cavity. Next, also disclosure of the root canal cavity, and further we can see difference. Next stage is removal of coronal pulp decay instead of amputation during pulpitis. It's difference. Removal of coronal pulp decay, not pulp, just decay, because of periodontitis. Next, the same, expansion of the mouth of the root canal. Then again difference, removal of decay of root canal pulp, not exactly root pulp, just decay because of periodontitis. And only after removal of decay of the root canal we may do research and measurement of the root canal length. During pulpitis, first we research and measure root canal and only then remove root pulp. Whereas during periodontitis, first we remove decay of root pulp and only after that research and measure root canal. And other stages are similar, are the same. Mechanical treatment and irrigation of root canal obturation with X-ray control, and the final stage is restoration of the crown of the tooth. There are several techniques of the root canal treatments, and we study two basic techniques. First of them is step-back technique. During this technique, the apical part of the root canal is prepared first, and the canal is then flared from apex to crown. Blockage of canals may occur using this technique and irrigation can be difficult. And the other technique is called crown down technique. This, along with several others, prepare the coronal part of the canal before the apical part. This has advantages and is the preferred technique because of less breakage of endodontic instrument. And there is the end of lecture. Thank you for your attention.